Hi there. My name is Dr. Aman Sohal, and I'm a consultant pediatric neurologist. Thank you for coming and seeing us today at Neuropedia. You've raised a very important point today about a condition called autism spectrum disorder. ASD is an umbrella term of a neurobehavioral condition, which is very commonly seen in children these days, and some studies have shown that up to 1 in 42 kids can have this condition. In that umbrella term of ASD, children can have what we call as social communication difficulties, speech and language difficulties, hyperactivity and ADHD, and sensory processing or sensory disorder as well. It's very important to diagnose this condition in early life, and there are some early warning signs which parents should understand and know about it, which is there are children who are sometimes speaking at the age of 18 months and suddenly stop speaking, and they have something called speech regression. Sometimes they're not responding to the name called, and the parents are calling them, but they're not responding. Some children don't point, and many of them have something called echolalia, which means they repeat what's being told to them. Many children have no imaginative play at all. And sometimes children who are excited or happy can have motor stereotypies or hand flapping or going on with the tiptoes. So these are some early warning signs which kids can have in ASD. How do we diagnose this condition? This is usually diagnosed by pediatric neurologists or neurodevelopmental pediatricians. For example, we do a test called ADOS, which is used worldwide to diagnose this condition. Once ASD is diagnosed, it's very important to manage it early as well. And the cornerstone for managing ASD is by doing therapies, which are ABA therapy, also called as behavioral therapy commonly, speech therapy, and occupational therapy. All these three therapies, when they're combined together, we can actually improve the child's behavior and also help in improving the quality of life. So it's very important that the parents recognize these early signs and bring their children to pediatric neurologists so we can diagnose the children early and they can have early intervention by these therapies. So thank you very much for coming and seeing us.